So last month was Oral Cancer Awareness Month, but that doesn't mean that you shouldn't know the warning signs and risks. That's why we're here at Hands Family Dental. I have Dr. Lindsay Hands with me now. Thanks for having us out here.
Thank you for coming.
Okay, so let's talk about those risks and warning signs. Who is at risk for oral cancer?
It happens in pretty much any age group. It's more common in men than women, and it's more common in people over 40. But lately we're seeing a lot of younger cases being diagnosed. Some of the risk factors include smoking, alcohol use, and also exposure to the HPV-16 virus.
Okay, so why do you think it's going towards younger people now?
I think a lot of it is because people don't smoke as much anymore, so that's cutting out some of the older smoking cases. But this HPV virus, it's the same virus that's responsible for cervical cancers. And we're seeing it in a lot of younger kids that don't have other risk factors, and so that's why it's shifting to a younger population.
Okay, so we've talked who's at risk. Now, if you've got something going on and you're wondering, ooh, what kind of symptoms do we need to be taking into consideration?
Any lump, red spot, white spot, ulcerated spot in your mouth that doesn't heal within 14 days, 2 weeks, have it checked out. That's usually how the oral cancer begins. When it's small, it's really easy to catch and remove. Other warning signs could be a larger lump or mass in your mouth or neck, difficulty chewing or swallowing, hoarseness that doesn't go away, or any kind of numbness or tingling in your face that does not go away.
Okay, so good things to be on the lookout for. You've got some pictures here.
We do.
Of oral cancer. So what are we looking at?
This picture, we're looking at kind of that white ulcerated spot that's in the back of someone's throat right next to their tonsils. That's a common spot for oral cancer, especially in smokers. As they inhale the smoke, that affects that tissue back there.
Okay,
so,
I think we've got another picture here.
This is the side of somebody's tongue. This is actually a very, also probably one of the most common spots that oral cancer starts is on the back side of your tongue. So that's why usually when you go to the dentist and they do oral cancer exams, they'll pull out your tongue and look at both sides just to make sure everything looks normal.
Wow. Okay, very thorough. And then what is this?
This is on the roof of someone's mouth on the other side of their teeth, and you can kind of see that bump right next to the teeth there, and that is also the beginning of oral cancer.
Now, how important is that early detection and getting it caught in time?
It's very, very important. Oral cancer has about a 50% 5-year survival rate, which is relatively low. And it's because a lot of people don't get the cancer detected at an early stage. It's very easy to treat it at an early stage, but it also spreads really easily to other tissues. So if you can get it early, it's easily removed and cured. If you don't get it early, it's a lot more dangerous for you.
And something you do here with every exam is an oral cancer screening.
Absolutely.
So we're going to see just how simple that process is. So
awesome.
We're going to bring someone in and sit in the chair.
Let's do it.
Earlier we were talking how early detection is key, and you do oral cancer screenings with every checkup. So what are you doing here?
Exactly. What we're doing here is we're just looking at the inside of the cheeks and the inside of the lips. I'm feeling everything just to make sure it's nice and smooth. I'm looking for any discolored patches, ulcerated regions. I'm going to have Kathy stick her tongue out for me. And what we're going to do is check each side of her tongue and feel it just to make sure it feels normal. And if you're at the dentist and doing this, obviously you're sat back in the dental chair. If you're at your physician's office, they usually just have you sit up on the table and they'll look in your mouth. The other thing that we do is feel around the floor of the mouth to make sure that there's no bumps or masses in there. Okay.
Now what's the next step? Let's say you do find something. What do they do then?
Usually what we'll do is if the patient has not noticed it or the patient thinks that maybe it was something that was caused by like biting their cheek or they burned their mouth with pizza or something like that, we'll wait for 2 weeks and see if it goes away. So we'll have the patient come back, we'll take a picture of it the day that the patient's in, then we'll have the patient come back in 2 weeks and check to see if it looks the same or if it's better. If it's not any better, then we send them to the oral surgeon and they usually have a biopsy of that area.
All right.
Yeah.
Well, you looked great. You did a good job there, patient. Great advice, great tips for those people out there. If you have any questions about oral cancer and you want to get in touch with Dr. Lindsay Hands here at Hands Family Dental, head to stayliving.tv after today's show and we'll get you connected.